Well, thank you very much. When I stand up here at this podium, it looks very similar to when I have stood up at the podium for Georgia. About the same number of people, the same passion for solving the cancer challenge, the same distribution in many ways. The difference is, instead of being from the island of Hawaii, the person would be from St. Simon's Island. Instead of being responsible for an entire nation's public health, they would be responsible for the health of public health in a particular county. Instead of being from a national advocacy organization, they would be from a local foundation committed to health care. But my point in that is that in many ways, these coalitions are microcosms of sea change. And the best ones are as broad and diverse and rich in talent and management ability and leadership as this one, and the weakest ones are light on their diversity. And so what we are about in our committee is to try to support these 70 or so comprehensive cancer control coalitions, one for each state and then several for the tribes, territories, and Pacific Island jurisdictions. We've been about that for several years. As Marcus said, it's a wonderful asset to the nation's inventory of resources dealing with the cancer challenge, and I think the best days are even yet to come. Why do we do this? Because these organizations at the state or local level are similar to this in that they're great engines for change, and change, of course, is what we're all about. Not change at the big national policy level, but where people actually live, eat, work, play, and pray, where the rubber meets the road. We've heard so much about leadership, and so when we say, how do we do this? Well, it's primarily to empower leaders. In my experience, every time there's a success, you can point to leadership as the primary driver, and every time there's failure, you can point to a lack of leadership. So we're all about leadership development throughout the great nation. We want to strengthen that leadership. We want to broaden the membership to make it as broad and deep and rich as this one. We want to take best practices and knowledge and take the very best examples of success among these 70 or so and share it broadly with others. And we want to celebrate success. We'll do a little of that today and tomorrow morning, because it's tough in the trenches from time to time, and it's appropriate to celebrate when things go well. One of the most profound things that happened this year is a technical assistance program that was put in place thanks to the generosity of the Susan G. Komen for the Cure folks and executed by our friends at Strategic Health Concepts. 13 states said we need help. They went through a formal application process, and the resources allowed for 2, Oregon and Oklahoma, to successfully engage our consultants, who went in and worked extensively with them and shared best practices, talked about issues in leadership, talked about organizational and structural challenges that they faced, and gave them some advice on how to improve that. And they're already reporting better outcomes based on that. So that technical assistance is one of the most specific and immediate changes we've seen throughout the last several years. It was a good piece of work. We aim to strengthen the coalitions everywhere. There's a wide range of capabilities among these 70. There's some superstars, there's some laggards, and there's some walking wounded. And so we spend a good bit of time at our committee talking about recognizing the success stories, sharing those widely with the community, and looking for untapped potential. There was a report from Oregon and Oklahoma both that once they began to talk about it, it really wasn't quite as bleak as they thought. And part of the magic was the energizing process of just hearing from others and how well they've done. You can talk about help, you can talk about pep talks, but when the rubber meets the road, you really have to give somebody some tools. And so we've spent a good bit of time talking about toolkits. We have experimented with developing one in particular to address the need to involve the business, the general business leadership in these statewide coalitions. And looking at some of the more successful ones, it's pretty clear that when you bring the business community to the table, just like sea change in general, good things can happen. So we've looked at all the underrepresented groups, or unrepresented or underrepresented, and started with business leadership and developed a value proposition for what it would mean to an organization. Of course, we've started with two prime prospects, the Fortune 100 companies to work for. By definition, they're saying that they want to take care of their people, they care about their workforce, and they want them to be healthy. So those are good prospects for engaging in a statewide coalition. And then the second, of course, is the CEO gold standard. Those companies, by definition, SAP in North Carolina, great example, appears on both lists. They're a perfect partner to be involved in the North Carolina coalition. We want to help them to see the value proposition, engage, provide leadership, support, encouragement at the State House, and other things. That's been a helpful thing. They're flying off the shelves, if you will, those toolkits, since they've been published. We recognized, as Marcus said, that the Affordable Care Act will have a profound impact on the plans that have been developed among the 70 coalitions. And so we sponsored a workshop, webinars to explain how the various components of a state cancer control plan would be affected beginning now and rolling up into 2014. You see the numbers of participation. That suggests that there's an appetite out there, and we believe there's even more. And we would remind you that those webinars are on the website and can be looked at. Again, they're very helpful, and again, strategic health concepts, and Komen did a good job of providing that support for us. When we look at these detailed plans, some of them are very accountable. They say this is how many percentage points improvement we're going to expect in screening this year. The first thing that you notice is what happens when the Affordable Care Act kicks in, and does that mean that others will be responsible for that screening, or other funds will come in for that screening, and therefore can you shift funds to another unmet need? So that's exactly what happens in this whole discussion of how the Affordable Care Act impacts these 70 plans, and it's been very helpful. And then, as I mentioned, the committee believes strongly that we need to celebrate success. We need to hold up as examples those people, those organizations, those heroes out there in the field who have done remarkable things, and hold them up with their peers and with you, and let them get some encouragement. And we believe strongly in that, and again, we'll do that. They are champions, and they need our support. We want to take the next steps in rolling out the business engagement toolkit. We want to further invest in these coalitions around the nation. We really want more people to be involved. This organization, again, is the role model. It's a full room. It's broadly supported by every sector in this most fragmented field of all, cancer, with so many players, so many people with good intentions, but only when they're all working in a coordinated way can it make a real dent. The same thing needs to happen at the state, tribe, territory, or Pacific Island jurisdiction level. And we need to engage with the national partnership. I sometimes delegate most of the national partnership relationship to Sea Change, but Sea Change is simply one of several in that rich partnership. And so now we're pleased to have some people who really know what they're doing and doing it every day. And we'll begin with a little discussion by a sector that Sea Change has always had good representation from. Our coalitions frequently do not. and that is our elected officials. So if I may, I'd call on Senator Baker to join me here at the podium and explain how she's engaged in Hawaii, and perhaps we can learn how to engage others of her peers from around the states. Senator?
Aloha, awina la kauko. Good afternoon, everyone. I'd like to say first, mahalo to Sea Change and the national partners for understanding the importance of collaboration in cancer control at the state, tribal, Pacific Island Territory, and local level, and for your continuing support of our efforts and challenging us to continuous improvement. I was asked to comment because I come from the state coalition world to talk a little bit about how Sea Change has assisted us, and given the direction from our moderator, I'll try to talk a little bit about how the coalitions and others can better engage elected officials at the state level. Hawaii has truly benefited from assistance and support from Sea Change and the national partners. In our 2006 successful advocacy for our comprehensive clean indoor air law, we relied on data, polling, and materials from the Campaign for Tobacco-Free Kids and ACS CAN. Being a part of the workshops that Sea Change has conducted for us helped us not to reinvent the wheel. We didn't have to use the limited and valuable resources that we have to come up with an idea that somebody else has already perfected. The face-to-face meetings and opportunities to learn from others to identify those best practices, receive the technical assistance that we need to translate what's working well in another jurisdiction that might be a big urban area with a small place like Hawaii is really very valuable. The webinars were also very useful to disseminate information, and I had the opportunity to participate in the ACA series. And looking at that act, I had been involved at the state level as the chair of Consumer Protection to put forward our health insurance exchange law, but to really sort of look at it specifically from the cancer lens was very, very useful, and gives me some ideas for some ways that we can go back and tweak our enabling legislation. But the direct interaction that Sea Change has provided and facilitated is really invaluable. All of these other tools are very useful and give us great ideas, but it's that opportunity to learn directly from one another, test out some ideas that's really very helpful. But let me share with you some specific examples from Hawaii that had its inspiration either directly from Sea Change or was germinated by others who had been under the Sea Change spell and found its way into our cancer plan implementation. One of our coalition members recently conducted a workshop on clinical trials for non-oncologists. We recognized in our plan and in our discussions that we don't have the number of people participating in clinical trials that we should, particularly given the diverse racial makeup of Hawaii's population. Only about 15% of cancer patients are ever told about their option to participate in clinical trials. Less than 3% ultimately take part. The rate is even lower if you look at racial and our ethnic minorities, older adults, and the medically and underserved groups who tend to have higher mortality rates of cancer than the population as a whole. We found that minorities were just as willing to participate in health research as those folks that look like me, the Caucasians, but are less likely to be invited to participate. So how could we sort of change that particular paradigm? Well, the workshop was designed to discuss advances made in cancer care that has resulted from clinical trials, the current participation rates, and the impacts for making further progress in cancer care, but to focus at the folks who might be actually the first ones to make a referral or to engage someone who has cancer or has been diagnosed with cancer, and that would be the primary care provider or the other folks who might not be cancer specialists. We wanted through this workshop to clarify common misconceptions among primary care providers about cancer clinical trials, giving them the information that they would need to make better informed decisions about whether to engage their patients in a dialogue about whether they would be suitable for clinical trials, including risks, benefits, and just how the process works. The whole notion of demystifying is very empowering. The workshop also reflected on the critical role of the referring physician being the first point of contact for patient access and participation in clinical trials. And by all of the feedback that we got from that first set of workshops, we know it was very successful, and so we're empowered to go further and try again and see if we can't reach a few more folks. Because we wanted to really look at the practical strategies that referring physicians can take to effectively prepare their patients for discussions with an oncologist about clinical trials, to optimize the communication with oncology professionals. We've, like every place else, has a shortage of oncologists. We have a shortage of doctors in general. But by engaging primary care providers, and we have under our law established that appropriately trained APRNs are primary care providers. So we're trying to expand and broaden the group of folks that may be able to assist us with doing some additional work in cancer care and making sure that we get folks most appropriate into clinical trials and get them into good treatment. Another area that I was particularly intrigued about, and I think my first experience was at one of these C-Change annual meetings a number of years ago, and it had to do with looking at the role of the patient navigator. I'm not a practitioner, but I'm very passionate about cancer control. I am a survivor. And at this C-Change meeting, there was a video about how a navigator really helped, and I think the one that stuck in my mind was a Native American woman who was diagnosed with cancer, and she was sitting in hearing her options, and then the navigator was talking with her after, and she said, you know, what did you understand from that? And the woman said that I'm not going to die this year. That really hit home with me, because it said to me that we have so many different ethnic groups that may not often interact with the medical profession. They may not understand all the things that the docs are saying, and a lot of times because some of the consultations and counseling are not reimbursed well, the docs don't get a chance to spend a lot of time, or they've got this huge caseload and they can't afford to. But the patient navigator can be that translator. So we set about to figure out how could we systematize it in Hawaii? How could we make sure that we weren't just putting somebody in who might know a little bit of the jargon but not really understand what they were saying? So we set about to create a training program. And we now have a continuing education certificate in patient navigation. It's done by one of our community college, which is now has a 4-year program, so it's changed its name. It's UH Maui College. And it's training for community cancer patient navigators. We have them trained in 14 different competencies. They get 48 hours of training and are engaged by over 30 faculty. And so far, as a result of this last round of training, this past June, we figured out that we had 130 graduates and others at our FQHCs targeting disparate populations. We have 12 formal patient navigator, cancer patient navigator positions that have been established in Hawaii since 2006. So we have some at our Queens Cancer Center, at Molokai General Hospital, that's one of our smaller, less populated islands, in Hilo Med Center, which is on the Big Island, at Maui Memorial, which is my island, and another one, a generalist in Hawaii County that's with one of the FQHCs. So these things I don't think would have been possible if we hadn't had the experiences and the collaboration and the working with C-Change and some of the other coalitions across the country as well as folks in our own state who are part of our coalition, really committed to being part of this enterprise of changing the community norms to make sure that we can deal as effectively as possible with trying to reach our goal, which is no more cancer in Hawaii. I think we have an opportunity to engage more folks in the elected legislative level, and I think that's one of the things that my coalition is going to try to do. You know, it's nice, I suppose, to have me as an advocate, but I need more of my colleagues because I'm not going to stay in the Hawaii State Senate forever, I know. And we want more people to be engaged and involved and as committed as possible. So thank you, Sea Change, for the opportunity to improve our efforts in Hawaii and for asking me to share some of the things that we're doing there in response to some of the initiatives. And I was told that maybe some of you have not actually engaged with your comprehensive cancer coalitions in your states and may not know what all we do or our cancer plan. So I brought a few copies. If anybody wants to see a sample of what one looks like, I'd be more than happy to share. Aloha.
Thank you, Senator. I dare say that everybody in this audience who participates in their coalition was going down the list of their own state senate and saying, do we have anybody like Senator Baker, and striking out. I wish we could clone you. Susan G. Komen for the Cure has been involved in every coalition and in every progressive movement in cancer control of this country, so we're lucky to have Shelley to join us and talk about your perspective.
Thank you. I'm just going to take a few minutes because I want to make sure we have enough time for the panel discussion. But Senator Baker, I would love to come see your cancer plant in person. I have never been to Hawaii, so someday I'll have to come visit. Thank you. Thank you very much. Komen for the Cures is really delighted to partner with Sea Change on some of these initiatives that you heard about in terms of the technical assistance and the ACA workshop and webinars that were conducted over the summer. And Komen joined the national partnership 2 years ago and have been more engaged on a national level in comprehensive cancer control. In addition to the work that our affiliates do, we have 120 affiliates across the country, and many, if not most of them, work with their state coalitions on cancer control efforts. And one of the things that I think is so important is, you know, we're here and we hear about all these national policy initiatives, but as Bill said, the coalitions and the people on the ground, that's where the rubber hits the road and the work really gets done. And I had the pleasure of sitting with our the women from the Fond du Lac cancer team, who you'll hear more about tomorrow when they are receive an award, and they were sharing their perspective on some of the, you know, discussion about palliative care and what they see in their local community. So these coalitions are so important in terms of translating the policy that we are talking about here into real change in the communities. And so I would echo the encouragement, if you or your organization is not already involved in these coalitions in your communities, to get involved in them and really make a difference at the local level. And I think also, you know, we all have worked in coalitions before. We are part of a coalition here at the Sea Change meeting, and part of it is just determining what your role is and how you can contribute. And I think what I heard, the feedback I heard from the technical assistance visits, is that that's where some of the coalitions have just needed some help. And I think Sea Change is uniquely positioned as a leader and a neutral convener to really help these coalitions to identify and talk through and communicate what their roles are and how they can all bring resources to the table, particularly as we heard from Dr. Plesha that some of the state health department roles are changing as the CDC changes some of its national priorities. That leaves the other coalition partners to really examine what their role is in the state coalitions, and Sea Change is really uniquely positioned to help them do that. And so we're really pleased to partner with Sea Change, and we'll continue to work with them and look forward to the discussion. Thank you.
Well, thank you, Shelley. As the mics are being distributed around and folks are formulating their questions, 3 hard questions in this direction, I'll call on Dr. Plesha. You're the only person who sees the annual progress reports from all of these coalitions, from the 70 or so around the nation. Give us a sense of the range of quality, from the high achievers to the strugglers, and some of the common themes you see in several groups.
Yeah, well, I'd say it's a bell-shaped curve. You know, you've got maybe a handful, 5, 6 coalitions at one end of the curve who are early adopters and really doing, you know, state-of-the-art work, and then at the other end you've got, you know, maybe 5 or 6 coalitions that are struggling and not making as much progress. And then everybody else, I think, sits in a fairly tight bell-shaped curve where, you know, they're making progress and there's a little bit of variation in between. But, you know, it's a little bit the comments I made earlier. We've been working for quite some time now to put these things in place, and I think some of that's paying off. They for the most part, are all very good quality. You asked about variation. I think the biggest thing that probably defines variation is resources. And as you all know, the most unfortunate thing is, you know, the states that suffer the greatest poverty and greatest disparity are generally the same states that have the least resources. And so those states struggle not only with the burden, but with the ability to have a lot of resources to put into combating some of those issues.
Senator Baker, does it help you with your colleagues when you're able to come back to the state Senate and say, this is how we're being perceived nationally as leaders, and it's appropriate that we allocate money for this program because we are out front and we will receive the benefits of prevention services that will make these investments pay off? Does it help having this kind of national endorsement?
It does, because it's a sort of an outside impartial validation that you're on the right track, and that there are standards that if you really care about the health of your population and what's happening to your people, you know, your constituents, then it's an easier sell.
Shelley, do your 120 affiliates call upon you to get technical assistance when they're frustrated that the Komen vision is not being acted upon in their own jurisdiction?
Oh, yes. They call upon us for assistance for a lot of different things. My colleague Molly Williams is here, and she leads our community health team. And the community health team supports our affiliates across the country in doing their needs assessment of the needs in the community and how they, where they can direct their funding efforts to make sure that they're making the most impact in their communities. And then we also have our public policy team that works with them on their advocacy for the National Breast and Cervical Cancer Program and their work on state coalitions and comprehensive cancer control, and also their work on a federal level. So we support them in those efforts from a national level at Susan G. Komen for the Cure.
Good.